What's up, everyone? Hope all is well. I hope you can hear me. We're going to get started in a couple minutes. I'm just going to do my normal testing first because I don't know how to test it just yet, like through the system. So I'm just going to pull it up. And while I'm testing that, uh, I'm going to reveal my guest, which some of you probably already know because I mentioned it. But I would like to welcome Amy to my basement. Amy, you're in my childhood right now, so I hope it's not too intimidating with all the toys. But let's see this. All right, we're on live there,
Awesome.
so you guys can see. So we're just checking that. Yeah, I just want to make sure that we can hear you, Amy. So can you talk into the microphone for
Sure.
me a little bit?
How's this? Good enough? Loud enough? Can you hear me? Hi, everyone. Can
It's a delay, so I gotta hear it.
Is it?
Somebody's watching. That's good. That's good. Awesome. Okay. We are off to the races. So, um, I'm super excited about this. Like, and here's why I'm super excited because I feel that oh gosh, like mental health is one of the most important things for everyone, every single person on this planet. How we process the outside world, it all goes through this brain, right?
Absolutely.
And um, we're perfectly imperfect beings, as I say. And as I've gotten older, I've just started to realize how incredibly important this is and how I feel that my observations are that everyone deals with stress, but nobody really knows how to necessarily deal with stress, or they've never been educated, or they've and they self-medicate, or they cope in ways that may seem okay at first and turn into a downward spiral at some point. Maybe never gets as serious and as bad for some, but it still affects their lives, it affects their relationship, it does a lot of things. um, and I think how it relates to Gracie Baja and everything else like that is, at the end of the day, our whole goal as instructors and as a school is to help people become their best self, and recognizing that the mental side of things, mental health, is a huge part. We understand, we feel like, obviously, you know having community and other people, like-minded people, is great for emotions and being able to relieve stress. But I think that being able to talk about some of the more serious stuff around mental health is really should be really helpful. So um, I want to. I'm just pulling up my information here so that I keep us on track to some degree.
Sounds good.
Um, so yeah, so today, like, just an overview of what we're going to talk about. We're going to look at just kind of the overview of mental health and stress and anxiety and depression, and how they're related to each other. Some of the symptoms that you might see with that, the prevalence of it, I think, of people that are self-medicating. And then we're going to also talk about when is it a good time to see a professional, and understanding that and knowing that, and some self-care stuff, some do-it-yourself stuff that you can hopefully take away from this tonight or tomorrow, and implement and see if that helps with some of the situations. So again, thanks for doing this,
Yeah, of
coming
course.
to my house, coming into the basement. And so what I think would be awesome is, I mentioned briefly, obviously, when I sent this out to our students, that you are in this field. You're a licensed clinical social worker,
Yep.
correct?
Yes, that's right.
So I'd love to hear your background. Um, and I'd love to hear, like, your experiences, obviously, and what you've done,
Sure.
and then go from there.
Okay, sounds good. So I got into this field after doing a master's in social work at Washington University in St. Louis. Go Cards!
Yeah.
And I am a licensed clinical social worker, which means after grad school you do a few years, 2 to 3, of supervised counseling and therapy, and then work and take tests and stuff to get your clinical license, and have continued to do continuing education. I started out as a therapist in an outpatient behavioral health clinic in
Mm.
Trenton, working with people who have severe and persistent mental illness, um, and no insurance or just Medicaid. So either
Yeah.
underinsured or not insured at all.
Yeah.
And did that for about 7 years.
Oh, wow. Okay.
Worked my way up there and coordinated the program for a while, supervising other counselors and therapists in training toward their clinical licensure as well. I have done private practice for the past several years, off and on, when my family life and work commitments and stuff allow. And for the past few years, have added also doing some clinical case management work with patients with chronic illnesses who've had stressful times adjusting to those chronic illnesses. I've been doing a lot of work with HIV patients recently, and am now transitioning to work with pregnant mothers and sort of reducing infant mortality and those kinds of things. So I've been in the Mercer County area doing this work for about 11 years, um, and happy to answer any questions anybody has.
Yeah. So that it's a pretty wide range
Yeah.
of
Yeah.
experience
Yeah.
in in those different settings. And so yeah, let's just dive right into it. And what I think would be great to start off with is getting an overall understanding of this. I don't know if I call it a spectrum of mental health disorders, and starting with just obviously general stress and how and why we get that, obviously, all the way up through anxiety and depression, and how connected are they? Is it kind of this thing? Yeah, because I think a lot of people are like, oh, somebody just has genetically their brain chemistry, they're going to be depressed. Can people become depressed that aren't born, with that type of brain
Sure.
chemistry, because things just spiral downward? Like, because I think sometimes there's a misconception there. They're not
Sure.
sure, like, oh,
Sure.
like, and so I'd love to just kind of start to talk a little bit about that and understand that better.
Yeah, sure. So I think one of the important things is everybody has stress, right? Everybody has stressors. Everybody has events that happen in their life. You get a new job, you get married, you have a baby, or you get a divorce, or you move across the country. Whatever you do, you have stressors in your life. And certain, stress as a reaction is normal. Anxiety as a reaction to that is normal. Some depressed mood as a reaction to that is also normal. And I kind of hate the word normal, by the
Yeah.
way, just as an aside.
Yeah.
But it's something that everybody deals with, right? That would be an expected sort of feeling or emotion that you would have. I think to answer this sort of question of genetics versus environment and life experience, I think we know people can be born predisposed to an anxiety disorder, a depressive disorder, or anything else. So, yes, genetics is important, but you also have lots of life events, traumatic events, things that happen that could trigger a reaction like this along the way. And so I personally feel like it's a combination. And from what I've seen with my patients and my clients, is that it's usually a combination.
Yeah.
Um, I think if you have a parent or a relative that has a depressive disorder or an anxiety disorder, probably more predisposed to that. But
Yeah.
what's the trigger? Like what sort of sets it off? And a lot of that is environmental and circumstantial.
Yeah. So a lot of it is could be some trauma that's happened as a child, or
Sure.
and because I feel like, it's we do, you're right, we do all have, we do go through all of these things throughout life, some way worse than others,
Absolutely.
some way worse than others. And it's, we don't really ever talk about or know or really have that much information, or at least I feel like people are scared to get help and ask about it when and so the reality is people don't really know how to handle it, or to think about it, or to even know that it's happening and affecting them.
Right.
And so, like what are some of the common symptoms that you've seen or you just know from your education that, and I know this is such a wide range of topics, so but I'm trying to just kind of almost get to some of the general
Yeah,
population
sure.
of stress and things that lead to, because anxiety to me seems like one of those things. And like I
Yeah.
know it's really prevalent, like in terms of statistics. Like,
Yeah.
can you go into
So,
that a little bit?
yeah. So, I actually looked this up earlier to see what the most common stats were. And so, in your lifetime, you have a 30% chance of having an anxiety disorder. You have a 17% chance of having a depressive disorder, right?
Yeah.
So, those are big numbers.
Yeah.
But unfortunately, only about a third of people that end up with one of those in one of those categories ever seek treatment at all.
Yeah.
So, I think we have a lot of work to do around the stigma
Yeah.
of that. And some of that's cultural too. I think people have a hard time reaching out for help, talking about their problems.
Yeah.
I think we're unfortunately sort of socialized to stuff our feelings and
Yes.
to not really
It's
share
a whole
them.
nother
Yeah, it's a
conversation.
whole conversation for
Yeah.
another day, right? And
Yeah.
particularly men, which is something
Right.
that you've talked about a lot
Yeah.
in the past. And so for people to say, like, okay, am I at this point where I need to reach out or talk to someone
Yeah.
is kind of a hard line to gauge. So, I mean, starting with stress, everybody has stress. That's something we all deal with. But how is it affecting your life? Is it affecting your relationships? Are other people in your life noticing? Are you able to work effectively and get your job done? Are you able to go to school and get your work done? Like,
Yeah.
are you crossing this line where you're becoming ineffective in what you need to be doing?
Yeah.
How deeply is it affecting you? Is
Yeah.
sort of my gauge for when is it a really good idea to go in and
Yeah.
talk to someone if you're talking about anxiety, right?
Yeah.
So general symptoms of anxiety are a lot of the things you would think of, feeling really stressed out, feeling really nervous, really anxious, sweating. Sometimes you get like, chest tightening if you're
Yeah.
having panic symptoms like
Yeah.
sweaty palms, racing heart, that kind of thing.
Yeah.
But sometimes it also presents as anger and irritability and restlessness and trouble sleeping and some
Yeah.
things that you may think of as being more depression, right?
Yeah.
There's a lot of overlap.
Yeah.
And so it's like, where do you draw the line between normal anxiety? So I'm starting a new job, I'm anxious, but I'm still going to go, I'm still going to get there. If I have an anxiety disorder and something's causing anxiety, it might cause enough anxiety to prevent me from following through on whatever it is I need to do. And so there are these sort of spectrums, these lines, and we all walk them, but it's sort of like, when does it tip over to become problematic? So I think, you know, just thinking about, is this passing? Is it something that's just like a transient thing that I'm feeling and I know it's going to go away? Getting up in front of a crowd, giving a presentation,
Right.
you get through it and it's over. You might feel a little embarrassed the first few minutes, but you do it and it's fine. If you're really battling with anxiety, you may not be able to get up on the stage at all, or you may then replay it for 3 hours after the fact and criticize yourself. Oh, I said this. Oh, I said that, and kind of pick yourself apart, right? So there's this like negative self-talk involved, a lot of like self-esteem implications involved when you have an anxiety disorder as well. So
And so for a lot of those cases, um, if somebody were to go to a therapist for that, whether they decided or not to, are there are there things that obviously they can do that the therapist teaches them that are self-care related types of things?
yeah, absolutely. I mean, so if you think about it, anxiety is a really healthy thing, right? It's where we get this flight or fight
Right.
response. Like there are certain things that come up in our life where we need that adrenaline rush to stay safe or to face something that's going on. So we don't want to like totally squash that emotion, but it's how do you contain it and how do you like work with it? And anxiety is very treatable. In therapy, there are all sorts of different skills and techniques that work really well. CBT, cognitive behavioral therapy, is used a lot for anxiety reduction, which is basically just like catching your negative thoughts, sort of challenging them. And there are different ways to do that.
Right.
But one of my favorite questions is, if I had this thought, what would you say to me? Right? Because usually the thoughts are really critical, self critical,
Right.
destructive. They're very black or white. And so when you're doing that to yourself, it's hard to be objective. So one of my favorite sort of challenge questions is, if a friend were going through this, what would you say to your friend? Or what other alternatives might there be to challenge this thought? And then you can change your thought. Changing your thoughts changes your behavior. And it's sort of this,
Yeah.
continual pattern that we
Yeah.
work through. Um,
I've tried to, because I've dealt with this, um, with anxiety, and I think I'm one of those. I think I'm one of those great case studies where I refuse to like go and talk to somebody, but
yeah,
recognize now it's like, man, I think I have anxiety, and I grew up in a society where you got to be tough. Like, you don't want to necessarily show your weakness, or it's okay to, but like playing sports too. I think you grow up and like
yeah,
you get knocked down, you get up, and that there's a lot of really good things about that. Having grit and
and
those things is
resilience.
good,
Yeah,
but resilience, it's a great
yeah,
word. But then there's also this other side to it that can become unhealthy.
right.
And I remember, gosh, it's like 10 years ago when I had my first business. It was really, really stressful. And I'm going to ask you about work-life balance in a second, because I think
Sure.
that's a really big one for a lot of people.
Yeah.
But my work-life balance was awful. And because I always felt like, if I messed up with this, or if I didn't do everything was going to fall apart. We'd lose our home. We'd be out in the
And there's
streets.
that catastrophic like thinking,
That
right? Like
and
you
I
go from this to
Yeah,
this.
exactly. And I
Yeah.
know, like what you're saying is there's probably ways you can get around that and say, is it really, is the world really going to
Yeah.
end if this happens? And
Yeah.
it's not,
Yeah.
right?
Yeah.
But
But it feels like that.
it does. It
Yeah.
feels that way.
Yeah.
And I remember at some point just being like, man, I can't breathe. Like I can't. I remember I couldn't take deep breaths.
Mhm.
And the more I tried to take a deep breath, the more I couldn't, and the worse it got. And then it felt like I just have like literally like a clamp on my chest, and I'm like, I gotta. My Dana's like, you gotta go to the doctor. I'm like, all right, I'm gonna go to this. So I went to the hospital, and they were like, there's nothing wrong with you. Like you don't have
Yeah.
anything going on. And then slowly, I still have it, and it comes up, and just over time being whatever, I'm like, man, I think this is what anxiety is. I think
Yeah.
this is how it
Yeah.
manifests for me. And so for people like that, like
So I think
what are some of the things you suggest?
yeah, I mean, I think there are people who have anxiety that causes panic attacks, right? Which is sort of what you're describing. It
Yeah.
can range from just feeling like that pressure in your chest
Yeah.
to feeling like you're having a full on heart attack. I mean,
Yeah.
people can't breathe, they're sweating, their arm is hurting. And
Yeah.
I've obviously not a doctor. So if that's happening, like get checked out. The
Yeah.
hospital's probably the right thing to do. But once all of that's cleared and okay, I have panic attacks.
Yeah.
There are lots of techniques that we teach in therapy for that as well.
Yeah.
Grounding is something we talk a lot about. Do you know about
Yeah, I
grounding?
don't
Have
know
you
what
done
grounding
anything? Okay.
is, no.
So grounding is basically this idea of it's twofold. It's sort of getting yourself back in touch with your body and where you are right now in the present moment, and also sort of distracting your mind a bit, right? So that you can't think about whatever that stressor is or whatever that
I would
thought
love
or
to be able to
feeling
do
was
that.
is
Yeah. I
that's
thought about
panicking.
meditation. Like, is that something? That was just very
So
hard. Sorry, go on.
yeah,
Sorry.
no, so meditation is great. Grounding is slightly different. Grounding also, just by the way, works really well for people that have had trauma and kind of have that sort of dissociating out of body feeling, or like they feel like they're gonna like kind of start to kind of lose touch with reality. Grounding works really well for that too. So there are a couple of really simple grounding techniques.
Mhm.
My favorite is it's like the 5 4 3 2 1, and it's your senses. So in the moment when you're starting to feel panicked, you got to think about, okay, 5 4 3 2 1. You have to find 5 things you can see. So if we were sitting in this room, okay, I see the Cardinals guy, I see the starting lineups, right? Like 5 things you can see.
Yeah.
And then it's like 4 that you can touch, 3 that you can, whatever. It's all of your senses.
Yeah.
Smell, something that you can like taste if you can't taste anything. Like,
Yeah.
and so I actually have it written down because
Yeah.
when you put me on the spot, I can't remember them.
Okay, sorry. By the
No,
way,
that's okay.
I'm thinking about that right now
Yeah.
as you're saying it, and I
Yeah.
smell Dana's cooking
Yeah,
right
it
now.
smells
So
delicious. Yeah, I can smell it too. So it's 5 see, 4 feel, 3 hear, 2 smell, and then 1 taste. So if you have something to drink, if
Yeah.
you have a piece of gum in your mouth, and the feeling would be like, okay, I feel both of my feet like firmly on the floor. I feel my butt in this chair. I can feel the table. It's like it's hard. It's a little cold, and you kind of just recenter your feelings into your body and distract your brain, so you're not thinking about the panic in your chest or whatever it was that kind of triggered that for you.
Yeah.
There was a great, is it Shi Jitsu? I think is like a Facebook group or Instagram something to
Yeah.
follow for jujitsu.
Uh-huh.
And they had a great post about grounding on the mats when you're in jujitsu, if you're panicking, and how to do that. So something maybe to look up.
Very cool. Very cool. Or they could just tap too.
Yeah, or you just tap.
No.
But there are other things like, the other one that we do for grounding is like ABCs, categories of ABCs. So you pick something, food, a color, animal, and you go through the alphabet and pick one for, like, A is for apple, B is for banana, C is for carrots, until you get to Z.
Yeah. And it's basically the idea, what it sounds like to me is it's just taking your mind. It's making you concentrate on something totally different.
Yeah.
So you distract from,
Yeah.
and not to bring this back to jiu-jitsu for a second, but one of the things that I found about why I think people love jiu-jitsu so much is, and how it helps with stress management. And that is, you have no choice but to be hyper focused on what's going on, because, and now, you should know that you're safe and your partner's there, but your senses are, all of them are pretty much firing. And that's all you're not thinking about, that late bill, or you're not thinking about your in-law or whatever it is. You don't have a choice. And so, for that hour, you don't have the ability to think about anything.
So you're totally in touch with your body.
Yeah.
And you've shut off your brain's ability to think about anything else, which is what we try to teach through grounding, and why I think jujitsu is so effective at stress reduction. Also things like running, because people love running when they're done. Nobody really loves running when they're running, because it's painful. In certain ways, right? And so you're in touch with your body, you're in touch with how your body's feeling and moving, and your brain is tuning out all of those other things.
It's so my next question, and I wanted to go back to it because I think it's I believe that it's a big issue with people in the workforce, is that home work relationship. And I go through that a lot as well. And I think maybe, and I think everybody does, but you get into the mindset of you gotta work because you want to be able to provide for your family, but then you're neglecting, and like being able to turn your brain off, especially with this, having this is a blessing and a curse. Do you ever deal with that? You in your time, have you had people that come in that have these issues? Or
of course, yeah. I think that it's a really personal thing. Work-life balance. When we talk about self-care and strategies for dealing with anxiety or depression, one of the things we have to look at is work-life balance, right? And part of that is figuring out what's necessary, because there are people who have less choice in how much they're working than others, right? Like, it's a very personal thing. But how much enjoyment can you build in to your life, and how much balance can you build in and maintain, because it affects your mental health very deeply. Those connections are so important. And when you start neglecting connections, like with your family, with your friends, with your communities, then your mental health suffers. And so that's something that we look at, on an individual basis. How much balance can you build in? How many enjoyable activities can you add into your life? How many people can you surround yourself with? It doesn't necessarily mean quantity, right? But quality of that connection. It's something that we've spent a lot of time talking about, is work-life balance.
And it's not just in another aspect of it. And I saw a post today that a friend of ours posted on Facebook, and I actually shared it with Dana. And it was like a letter from a woman to all moms about being able to love again and love themselves again, in the sense that basically it got into so many moms, and it doesn't have to be moms, but it just seems to me that it happens to them more often than not. And that's a whole nother topic that I want to talk about, primal instincts and socialization and all that. But, you got 2-3 kids that are young, and like all you're doing 24/7 is being selfless. You're being parent, and you're just serving them, and you lose touch with of who you are and who you are and yourself
Right.
and everything else.
Right.
And
Right.
do you have any and so like why I said that to Dana, because I think a lot of parents go through it, a lot of moms go through it too, is trying to encourage her to carve out that time for herself,
Right. Right.
and she doesn't allow herself to do it, but
That's the mom guilt. Yeah.
yeah, right. I
Yeah.
mean, of course,
Yeah. Yeah.
and I'm not trying to generalize and say it's just moms,
No, I
but
know.
I do think that there's some aspect of a primal instincts that women
Yeah.
tend to be in that position more, do that more. Can you talk about that a little bit? Is there, because it's
Yeah.
such a really
It is a
important.
really important thing. And I've been saying this for years. When I first started doing therapy, particularly in the trend community, there were like some recurring themes, right? Like everyone is their own world and everyone has their own story and they're fascinating stories.
Yeah,
But there were these recurring themes. And one of the most common in all of the sort of middle aged, depressed women that I was seeing, it was like I gave up my life for everyone else. I put my life on hold for everyone else. And now they have their own lives and they don't have time for me. And I heard this story so many times, so many days, so many years in a row. So I think my one piece of advice would be stop that now
yeah,
before it starts. Like work life balance is important, but also maintaining your own identity as you're a parent, fine. You're a wife, a husband, fine. You're a sister, brother, fine. But also you're you, right?
right,
And maintaining some sense of that, not isolating yourself. Even if you maintain one hobby or one activity, just something that's
yeah,
yours that
yeah.
you can hold on to. Because I have heard that line so many times. I think it's so common. And it's a hard thing to find new communities and new activities and to figure out who you are decades down the line, right? When your kids are grown and gone and making their own lives. And
Yeah.
so none of this is easy stuff. It's easy for me to say. None
Right.
of it's easy to do, but I think it's really important.
Is that something that is, I think many women need help, and I bucket this in the same as that work life balance, because to me
Yeah,
there's a similarity in the cycle of not allowing yourself to do it for good, for a reason of
sure.
you're trying to serve and you're trying to, and you can, working moms and working dads or stay-at-home dads, moms, it doesn't matter at the end of the day,
But I
but
think you have to remember, like, you can't pour from an empty cup, right? It's
right,
like you're on
right,
the plane and you're putting on your kid's mask first. It doesn't matter if you're going to pass out. Like, you have to put your own air mask on
yeah,
before you do your kid.
yeah,
That's why they tell you that. And
yeah,
it's the same with life. If you are completely exhausted and overwhelmed and stressed out and anxious and,
yeah.
you can't figure out your own balance, you're not as effective with your kids anyway.
How do
So
we get that through to more
I
women to
know.
do that, right? How
I
do
know.
we, how is it?
To
That's what
anybody, to anybody.
yeah, to anybody, yeah, of
Yeah.
course, yeah,
And I think that's where a lot of this anxiety and stress in modern society comes from anyway. We
yeah,
try to squeeze so much in so little time. And I'll go back to this. It's not necessarily the quantity, it's the quality, right? So turn off the phone, turn off the tablet, spend some quality time together.
yeah.
If you need to exercise as a family and take a walk in the park, it's like two birds, one stone. I like maybe you get creative, right? But I think it's really important to focus on those connections. And another thing that comes up when people are anxious and depressed is that they tend to isolate. And so this is exactly the opposite of what you want, right? You have, like, one of the things that we tell people first on the list of self-care, work-life balance, and reduce your isolation as much as you want to just sort of be by yourself and
It
not
makes
have
it
those
worse.
connections.
It makes
It
it
makes it
worse.
worse.
It does.
Yeah.
Um, Two things on that. I've experienced that myself, and so people don't necessarily know. I work from 7 a.m. and they may not see me in the school, but I'm working literally, at 7 a.m. until 10 o'clock at night. And so half of my workday is here at my house, and it gets very lonely and isolating. I got my boy Bubba with me, but and there's days when I have, I'm just going, it's just a rough day. It feels like everything's going to come crashing down. It
Yeah.
feels like the business is going to fail. Everyone's going to leave the school. And I know those are like dumb thoughts, but yeah, you have those days once in a while. At least I do. And I do just want to isolate myself. And it's hard to get out of the house. Luckily, most of the time I have to go into the school. And what I always notice is when I go into the school, and I
You'll feel
see
better.
everyone, I train, I feel fantastic, and
True.
it's. But I'm lucky in that I have to go. If I didn't necessarily have to, I feel like some days I wouldn't necessarily do it, and I would just get in a worse
And
position.
that's the catch 22 when we sort of move over to the depression side,
Yeah,
right? One of the primary symptoms of depression is sort of the lack of interest in doing things and
yeah,
often the lack of energy to do things.
yeah,
We know one of the most effective treatments is to get up and do things, but you're talking to somebody who has no ability really in that moment to do that. And so that's a really tough balance as well. I would say again for people who, maybe just have low mood, who aren't necessarily really actually like depressed, it's an easier prescription to say, add some exercise, add some community into your life. um, it just also, I feel like I need to say this. So for major depression, there's a whole host of category like of criteria that people have to meet for a certain amount of time, right? And it doesn't necessarily mean you're not getting out of bed and you're not taking care of yourself. I think we have that misconception that if someone's really depressed, like they're kind of just like loafing around
right. Like you've seen where people like, unfortunately, if they end up committing suicide, they're like, oh, they seemed like they were the
they seem so
happiest.
great.
Yeah,
There are a lot of people who can still get through their day, who can still do what they need to do, but who just have sort of this sadness that's sort of pervasive, right? Or they have loss of interest and pleasure in doing things that they used to have, or they are sort of slower in their body or their speech. And there are a lot of symptoms that we can talk about when we talk about depression, right? And maybe you don't get a depression diagnosis. Maybe there are lots of options.
right.
But if you're feeling that way, if you're feeling, sort of hopeless or empty or like helpless about things, I think it's definitely worth like talking to someone and exploring. But it all leads back to the self care thing, right? Like exercise, nutrition, sleep, work life balance. And these are hard things when you don't feel like it's worth it or you're worth
Right.
it. And so there's this constant push and pull between what we need to do to make ourselves feel better and then not feeling well enough to do it. And so that's kind of, if you find yourself in that situation, I think a good indication that you might want to talk to somebody to help you,
Yeah.
sort of
And
sort
so I
through
want
that.
to, that's a good segue. Although I want to talk about, um, now let's get into that first. Because then my other topic that I want to talk about is the prevalence of the self medication, which I
Yeah.
think is a big thing.
Yeah.
So I think this is where a lot of people stop, in that they recognize they have these issues, and like you said before, they don't necessarily, they feel like there's a stigma, they don't want to come out and ask for help, and many times they just don't know where to start. They're afraid of how much it's going to cost or whatever. Can you talk about like what are the recommendations, and like who are the types of professionals you should call, and what also like expectations of cost and things of that, and
Sure.
I know cost can vary, but like
Absolutely.
I think these are the questions that people have. They say you may look up Google, and but not knowing, like you're afraid to
Yeah.
call, like
Yeah.
should we get like a little idea of something like that?
So, I mean, we have a lot of options. That's the good news, right? So, there are clinical psychologists, there are licensed clinical social workers, licensed professional counselors. It really, at the end of the day, it's all therapy. It all sort of works the same way. It depends a lot on sort of their framework and um, I mean, you can definitely look into the differences. Like, I'm a social worker, so that's my bias, right?
Yeah.
And in our training, we look at sort of a whole biopsychosocial picture of your environment and your, the other influences that you have going on. A lot of psychologists will focus more on like testing, or they'll do like psychotherapy, psychodynamic therapy, or like a lot of the like sort of longer term,
You
like
said that's
stereotypical,
more
like
of
lie
a,
on my
you said
couch
that's
and
more of a what? That's a
like a
psych
psychodynamic kind
the
of
psychotherapist though? Is that what
psychotherapy. I mean, they all do, so we all do psychotherapy, right?
okay.
But the styles are different. And everyone has their specialty. You can't really go wrong. I think more important than the letters after someone's name are the feelings you have when you're sitting with them. Do you feel connected? Do you have a good rapport with that person? Do you feel like you can say what you need to say? Like, are you getting some direction? Are you getting some help out of your sessions? Um, there are some websites like Psychology Today is a good one where you can plug in your zip code, you can plug in your insurance plan, and it'll pull up a directory for you. You can see the people's pictures, you can read like a bio that they've written. It's kind of a nice way to get a little preview of each person to see who you think might be a good
Yeah.
fit. Also, if you have health insurance, your health insurance company is a good place to start. Usually on the website, there's a directory where you can get a list of people who are in network. That's the cheaper way to go.
See, I was going to even say, like, I didn't even think a lot of it's covered, because I don't know
Yeah.
if how, and I'm sure a lot of
Yeah.
this working with Blue Cross, right?
Yeah. Yeah.
Um, is that something that's
So,
changed over time in terms of the coverage, and like is it considered like an optional thing to some degree? Do you know
so
what I mean?
in my experience, most plans right now are like most private commercial plans are covering mental health. It's just a copay. Like if you were to go to your
Oh,
primary
okay.
care doctor,
Do you need a referral
you
typically or no?
don't typically need a referral for mental health. And usually it's capped at 20 sessions or 30, whatever your plan is, 20,
Mhm.
30 sessions a year. And that can be changed if necessary. Sometimes it's just a matter of getting an authorization to do that.
Yeah.
Um, but I think the bigger thing is that there aren't a lot of people. Let me rephrase. There are plenty of people in network who will take insurance. A lot of practitioners will not. They will work on an out of network basis, and then they'll give you paperwork to submit to get reimbursed.
I know this landscape very well
Yes, so this is a little more common.
because not to go off track, but my background is also as a partner in physical therapy,
Yeah.
and we in New Jersey, and years and years and years ago, went out of network for the reason of just the reimbursement rates were so low.
Yes.
You couldn't have a sustainable practice
Yes.
if you just weren't. So that I
Yes.
assume that's the
So
reason why they do it.
this is part of the reason. It's
Yeah.
also really the amount of paperwork is really cumbersome, and then it creates this imbalance in the practitioner's time
Sure.
and billable hours. So a lot of people will just go out of network and then you have to
Yeah.
get reimbursed. If that's something that's feasible for you, I wouldn't let that be a turnoff to going to see someone. But if you need someone in network, starting with your insurance plan to get a list, and then I know it's uncomfortable, but word of mouth is also a really good way to find quality therapists in the area.
And then typically that first session, is it kind of I'm sure maybe many are different, but is it more of an exploratory, like how is like a first session of if you were to meet with somebody, you find somebody that you think you're comfortable with, you sit down, and what happens?
Yeah, I
What do
mean,
you-
so I think from like the patient's perspective, right? If I'm going in to see someone, the expectation for me and in my experience, you go in
Yeah.
and they sort of say, okay, what brought you here today? Like, this is a big step. You've taken this big step to come to therapy, right? It's a hurdle, right? There's a stigma. We just sat here and talked for I don't know how long about the stigma and the hurdles to getting there.
37 minutes.
Yeah,
and
37
counting.
minutes in. And so, like, what brought you to the office and what are you hoping to get out of coming here? And from the therapist side, they really want to get to know you and why you're there. There's also a bit of a risk assessment. Like, is this person suicidal? Are they, like how
Almost like a screen.
it's like a screening,
Yeah.
like how serious are we talking? Like what's actually going on?
Yeah.
And so, unfortunately for insurance, often they have to come up with a diagnosis in the first session, which as a practitioner, I find really uncomfortable. So usually we just do something simple like adjustment disorder, or because we don't have that
Not
relationship
totally
yet.
sure
We don't
yet,
have a
right.
full picture.
Yeah.
So that's kind of where it starts. And I always tell people, if it's not a problem for you in your life, it doesn't have to be a problem we talk about in therapy. And at some point, if you are ready or comfortable to talk about it, then we bring it up and we go from there. Obviously, there are exceptions to that. If people are coming in for substance abuse disorders and there's some level of denial there, it may not be a problem for you, but that's why we're here. So
Yeah.
we have to talk about it. But like if you have a trauma history or if you have something that you know needs to be addressed, but you don't feel comfortable yet,
Yeah.
you sort of set the pace. So if you go in and you feel really pressured, I would say try
Maybe
someone else.
Yeah. Yeah.
If you come out feeling completely unchallenged, also maybe
yeah.
find someone else.
Yeah.
Yeah.
Speaking of substance abuse, I'm going to segue.
Yeah.
And that was all really helpful. Thank you. That's awesome. And even for me personally, just I think a lot of people just like don't know what to expect and feel.
One other thing I just remembered, I learned this week. I'm going to have to look it up. I'll get back to you so you can post it wherever you need to. I learned that there is a website that is just for low cost sliding scale counseling sessions.
Oh, cool.
So I think, because that's also difficult to find sometimes. And I just learned this week that there's one, and that's all they do. So I'm going to see if I can get the name for you.
Another question that I have is like, obviously, I think you've seen teletherapy being a little
Yes.
bit bigger.
Yeah.
Is that a viable? Do you feel like that's like because obviously being in person probably has some advantages as
Sure.
well, but what about
I
teletherapy?
think it's great. I think it breaks down a lot of barriers. I think it opens a lot of doors for people who are too busy. They can't get away from their office. They
Yeah,
need to do therapy on their lunch break, or therapists who don't have a lot of evening appointments can fit people in during the day. People who are in more rural communities or the therapists aren't readily accessible. I think it really breaks down a lot of barriers. And for people who don't have severe mental illness, there's no psychosis, there's no suicidal ideation, there's none of that stuff. I think if what you need is just some talk therapy,
talking to
like I think it's a great option.
yeah, that's
So,
great.
and most of them are, HIPAA compliant and
Yeah.
all of that. So
Yeah, so the next topic that I wanted to talk about and ask you questions on is just this, and again, my observation that the majority of people in the majority of humans, the majority of adults are utilizing some self-medicating strategies. Um, I would say that the simplest, most innocent one to some degree, because most can handle it, is alcohol.
sure.
Just simply because you've had a long week, man, 2, 3 drinks, it kind of just does the job, right? It gets you to
It numbs
relax,
you out.
it numbs you out,
Yeah.
and then comes back later when you're done. Um, what is there anything? Because I guess at the end of the day, what I'm getting at here is, and I think for men or women, it doesn't really matter. Men is a whole other situation we've talked about in terms of the man box and the socialization that men have to be strong and can't
Right.
show weakness and
Right.
can't show vulnerability. And I've always struggled with trying to explain. I found that there's this misconception that of course you can have grit and courage, but also be vulnerable and expressive with things. I think people feel like it's like one or the other, like but nonetheless, obviously one of the things that I saw that men actually died by suicide almost like 3 times more than women. However, what's interesting is women actually attempt suicide almost as much, if not more, than men. So men are actually
They choose more lethal
they choose more
methods.
lethal
Yeah.
methods.
Yeah.
I just want to talk a little bit about that and get your thoughts on how prevalent do you think this self medication, and where's the line there? Like, to some degree, okay, it's okay. Like, hey, we over the weekends we're around friends, have a couple of drinks. It's great. It's a good way to deal with it. When does it start to go too far? And then that kind of downward cycle. And just want to get your thoughts on
Yeah,
some
so
of
here's the thing. It's effective, right? You have your few drinks and
that.
it does its job.
Yeah,
You smoke whatever you're smoking. It
yeah.
does its
If you want
job.
to
Like
smoke weed, whatever. Yeah,
whatever. Like
yeah,
it does what you need it to do,
yeah,
right? We go back to the same idea that just like mental health issues, anxiety, depression, you have a lot of genetic bias here. And then is there some environmental trigger? And so for some people, you can drink all you want, you can smoke whatever you want to smoke, no big deal. You're not going to get addicted. It's going to help you. Yeah, it's effective. Is it
yeah.
the healthiest coping skill? I'll leave that for you to decide. But
I've heard a glass of wine a day is
yeah,
actually really
yeah,
good. So
right.
right.
And we know that there are benefits to marijuana too, like
Right. Of
medically.
course.
So I'm
Yeah.
not here to debate that.
No.
But I think if you are a person who has some sort of genetic disposition to an addiction or an addiction, right?
Yeah.
And then you're using this as your primary coping mechanism, at what point does the scale tip over and then it becomes a problem? So I think and people can obviously become addicted to substances without that genetic component as well.
Yeah.
But if you're a person who has that background or has an addictive sort of personality, you tend to like hone in and focus on things and sort of get addicted to things
Yeah.
easily, you might want to sort of lay off of those things as coping skills,
Yeah.
because they become easy crutches. And I think the healthier choice would be go to therapy, talk to someone, get some real coping skills. I'm not saying don't have your glass of wine or don't, but I think we have to be careful.
Yeah,
Yeah,
I agree. Awesome. Yeah, because I think at the end of the day, there's so much gray area there for most of us,
a lot.
and how, and damn, we all deal with stress. We all go through things, have traumatic episodes in our past or whatever it may be, and just I've always found that it's most people just don't know what to do, or or push it down or ignore it, and it may turn into something worse down the road.
Sure.
It may manifest as irritability and anger, and that causes relationship damage with your children or your significant other, whatever it may be.
Absolutely.
And I love what you said before, and it's we found a lot of this in our research with the Not on My Watch stuff in terms of what makes people most happy in life. And there's that really great Harvard study that's been going on for like 81 years. And they said they've followed, I don't know, it was like 800 men since like
It's the
19,
connection, right?
yeah, all, it didn't matter how wealthy they were. And there were some presidents that were in that. I believe JFK was one of the ones. It didn't matter how wealthy you were, if you were famous, whatever. What made people happiest in life was their connections to others
Mhm.
and the quality of those connections. And so I think just going back and tying that all together,
Yeah.
where it probably manifests the most is a lot of this stress and anxiety can manifest in your relationship with others, and how that breaks down over time, and could result in unhappiness and
Absolutely.
physical issues as well, potentially, but obviously a lot of mental issues. Um, so what I wanted to try and talk about, just as I think, because I think it would be really valuable for the general population, is some common things, or some self-care things that you think they could take away today and try out and see if that helps ground them, or helps them kind of take
Right.
the mind off of their stress, or help manage that stress or
Okay.
anxiety.
So, I mean, I've referenced a few things. Like, obviously, the easy ones are exercise, right? Getting enough sleep,
Yeah,
which is tough.
jujitsu.
Yeah, do jujitsu.
Yeah,
When we talk about work-life balance and family balance, getting enough sleep, I think, is a huge barrier for a lot of people. So, prioritizing sleep,
do they
having,
say how much sleep, by the way,
I mean,
typically?
7 to 9 hours,
Okay,
right?
yeah.
But sleep hygiene is really important as well. So we always tell people an hour before you want to be asleep, like try to have a consistent bedtime and a
Hmm.
consistent wake up time. So for the sake of argument, let's say your bedtime is now 11 p.m. So an hour before that at 10 p.m., anything that has a power button in your house gets turned off.
Mm.
Anything with a power button, batteries, cables, turn it off. You can read, you can talk to your significant other, talk to your kids, talk to your pets, read a book, like whatever. But anything with a power button goes off an hour before bedtime. And you should have the same nighttime routine every night. So if you shower, or if you do that in the morning, whatever, but brush your teeth, like whatever your nighttime routine is, should be the same every night in that last hour before you sleep. Um, so sleeping is important, nutrition is important, making healthy food choices, not overwhelming your body with sugar, because we know that that does things to our hormone system and regulation and whatnot. um, I think in terms of practical things, exercise is the number one option, because it gets you in touch with your body, it gets you out of your head. Do the grounding exercises if you need them. I can send that to you, but
Hmm.
basically just get really in touch with your physical surroundings, physically feel where you are, where your body is in space. I'm in your house right now, I'm in your basement, I'm sitting in this chair, right? The floor is
Possibly in
soft.
my childhood
Yeah.
consciousness, by
Yeah.
the way.
Yeah. And then breathing exercises. It sounds so silly. And in the beginning, when I was teaching people how to do them, I wasn't sure they would work,
Yeah.
but they do work. And there's a lot of scientific reasonings like behind why they work. Uh, Breathing exercises. The most simple one, you should try this for
Yeah.
your anxiety,
I
by
will.
the way,
I will.
uh,
I'm all
is
ears.
is square breathing or box breathing. And it's called that because like a square is the same on all sides. So you choose a number of seconds. Typically, we start with 4. You breathe in for 4 seconds,
Hmm.
hold for 4 seconds, out for 4. So it's like
And then take a
hold,
break, and
in,
then yeah.
hold, out, hold, and you just kind of keep going. So you do the yeah, in,
Yeah.
hold, out, hold. You do the cycle 4 times, And we recommend starting with 4 times a day. And it like, so I actually wrote this down too because you put me on the spot and I cannot
Nice.
remember
I
anything.
like putting people on the spot.
Yeah. So it actually, when you do the deep breathing, it calms your autonomic nervous system, right? And so that's the system that like does involuntary things like your temperature control, your blood pressure control,
Mhm.
and it actually brings all of that stuff
Oh,
down.
that's awesome.
And then when you hold your breath and the carbon dioxide sort of gets into your bloodstream, that actually does stuff too.
Yeah.
So it enhances, let me see, your cardio inhibitory response of the vagus nerve. So when you exhale, it stimulates your parasympathetic nervous system,
Mm.
producing calm and relaxed feelings. So there you have the science in case you
Yes.
needed that.
Yes.
But so that's one. The other really common one is the 4-7-8. So you inhale for 4, hold for 7, and exhale for 8.
Mm.
They teach this in a lot of yoga classes. They teach it for good sleep hygiene. If you can't sleep, you can do the 4-7-8 a few times. But the idea is to focus in either of these exercises to focus completely on your breath and not on what's going on around you,
Right.
right?
Right.
And if you catch your mind wandering, no big deal. Just kind of remind yourself to keep breathing
Yeah.
and try to do it a few times a day. So,
Awesome.
I would say exercise, breathing, work-life balance.
Yeah.
My sister likes to say, find things that add happy. This is becoming my new motto. Find things that add happy to your life. Do more
Yeah.
of those things.
Yeah. Yeah.
It's hard if you are struggling with depression or anxiety to feel like things are bringing you joy.
Yeah.
So anything you can find that does,
Mm-hmm.
do more of that.
Mm-hmm.
Unless it's a maladaptive coping thing, like self-medicating.
Right.
In which
Right.
case, reach out to your therapist.
Right. Right.
I would say too, just because I feel like I should. We were talking earlier that the tip over is like, how is it affecting your life? Are other people noticing? Can you get what you need to get done? But if you're having any sort of thoughts of hurting yourself or hurting someone else, like that's an
Yeah.
automatic,
Yeah.
like
Yeah. It's the.
get yourself some therapy.
Yeah. Of
Yeah.
course.
Yeah. And if it's like now imminent, get yourself to an emergency room.
Yeah.
Um,
So that's a good point. And I know that like if you don't know where to go, you can still always just go to a hospital.
go to the hospital, go to the emergency room. You
Yeah.
can, if you can't get yourself there, you can call 911.
Yeah.
In Mercer County, we have crisis response. So there's a number you can call and they'll come to you. The like blanking on my terminology right now,
Yeah.
but the designated, that was what I was looking for.
Yeah.
The designated screening center in Mercer County is at Capitol Health in Trenton.
Okay.
But they have a mobile crisis unit that will come out
Cool.
to you as well.
Very cool. I think we had somebody at the school that used to
Daniela works there, I think.
Daniela, right? She used to, and Danny, I think, used to.
Alicia as well.
Alicia, sorry,
Yeah.
Alicia used to, I think, do that,
Mhm.
or maybe does that now still as well.
Yeah.
That's right. That's
So, but you can go to any of the other hospitals as well, and they will get a screener there to screen.
Yeah.
So yeah, I mean, if you just sort of have passive, like vague thoughts about death or dying or those kinds of things are worth seeing someone. If it's imminent or you feel like you have a plan or it's more serious, then definitely reach out for help.
I know, and I think when people feel like they want to run away from the situation or whatever, like do you get sometimes if people are feeling like, hey, I just want to exit this, and it's not necessarily like, hey, I want to kill myself. It's I
don't want to do
I
this
just
anymore.
want to be take me to another planet right now.
Yeah.
Talk about a little bit about the difference between those two.
Unfortunately, I think I just want to not do this anymore and not feel this anymore often leads to more suicide than we think it does. I don't, most of the time, I think it's not, I want to die. It's, I want this to stop.
Right.
And so it's a pretty slippery slope. I think if you're starting to have thoughts like that, it would definitely be worth talking to someone about. I'm not saying you obviously end up going down that road, but I think it's a really slippery slope.
Right.
So I think that's usually where it starts. And we all have moments like that. I had a moment like that on Sunday. I was like, do you not want to do this anymore? Like, what was I thinking?
Yeah.
But it's fleeting and it's fleeting and you get through it.
So you feel like obviously if it's just kind of those fleeting moments, you're okay. It's okay. It's normal.
Yeah.
So, because I'm asking because I've had those feelings when just things are just, I think it's tied into the anxiety or whatever, just overwhelming and be like, gosh, I need help. Like, but then you realize like tomorrow's fine, or like 3 hours later, you're fine.
It's
You know,
fine.
you get out
Yeah.
of it and you kind of, one of the things I remember somebody said is like, as an entrepreneur, you know, it's like your day and your weeks are like this.
Yeah.
It's like that up and down.
Yeah.
And you just have to learn to be like this as best as possible. Meaning just like knowing that you're gonna have really, really bad days and you're gonna have good days. And it's funny, like even on the good days, I remember even just not necessarily as an entrepreneur, but even as when I did some sales stuff or whatever, you'd have like these great conversations with these potential prospects or whatever, and these big sales, and then nothing ever comes of it.
Right.
And you know, you have enough of those, like, okay, I should not get too excited about these things because they're great, but like this is just the way that it is. So,
Yeah.
so what you're saying is like,
yeah.
you're gonna have those.
You're
ups
gonna
and downs.
have ups and downs, and I think if you have some insight and some awareness about your own feelings and know like this is fleeting, this is not my normal, that's one thing, right? If it becomes sort of your normal thought process, or it's happening more often,
Yeah.
or it's, you know, worrying you, definitely see someone.
Yeah.
But we tell people the same thing, like emotions do this, right? They ebb and flow. And so we tell people, don't get on the train, like don't hop on the roller coaster, just like watch it go by.
Yeah.
Like you might feel really bad right now, but you don't have to hop on
Yeah.
that train and ride it.
like
You can
that.
just kind of let it, just watch it go.
Yeah.
Like recognize it, I feel terrible, and then just watch it go.
Yeah.
So
awesome. This was awesome. Thank you.
yeah, of course.
We are clocking in at about almost an hour.
Free therapy, no?
Yeah. I'll send you the copay, by the way. I don't know what my insurance takes though, but Amy, thanks. This was fantastic.
Anytime.
And there's so much more to talk about, obviously, and getting into specifics. What, you know, getting into kids and parents and handling those things, and you know, I mean, there's, so hopefully have you back on at some other point in time. We can talk about more stuff. We'll post anything to this thread. If there's any links or anything we want to share, I'll get that stuff from you afterwards. But thanks again. I really appreciate it. Thanks whoever actually stayed on this whole time. It's going to be up on our Facebook page for quite some time. I'm going to also download it to our YouTube page. We have it there as well. So everyone have a great night. If I don't see you, get on the mats, and talk to you soon. Bye.